Welcome to yet another informative edition of Talking Health. Today, we shall continue with our discussion on fibroid, with time could not permit us finish the last time. Already, we know what fibroids are, where they grow, how they grow, and the associated symptoms, among other things. So today, we'll be wrapping up that topic with a panoramic understanding of the ailment as Dr. Kayode Adebayo, an obstetrician, gynecologist, and medical director at Dayspring Hospital here in Lagos, continues shedding light on our concerns. Welcome. I am Bumi Idowu.
The life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only. I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Okay, you know, it's easy if somebody has high blood pressure right in the corner of your home to know that, oh, I have this ailment. But how easy is it for a woman to know that she has fibroid?
The person check the blood pressure too.
Yes.
The person check the blood pressure. Yes.
Absolutely. But how easy is that for a woman to sit in the corner of her home and detect that she's got fibroid?
Well, it might not be so easy. There are just some signs that a woman might see that may make her think of fibroid until otherwise proven. Just like I said earlier, a woman knows that she normally has menstrual pain. That doesn't bother her because she knows that with first few days of her before a day or two before her menses, this pain comes up. And as soon as she started having the flow, the pain started going down gradually. And by the time she finished her flows, the pain has disappeared. That could be perfectly normal for most women. But by the time the same woman is telling her, doctor, I used to have pain that lasts 1 or 2 or 3 days after before my menses dried up, the pain has gone. But recently now, this pain keep on for 1 or 2 weeks. I just admitted somebody with the same complaint a few hours ago. And this pain keep coming on. And I now realize that, I now realize that I use 1 pack of sanitary pad. The first day I use only one. The second day I use about 2. The third day I use 3. Then the last day I just use the remaining 1 or 2 pieces, and that is all. I don't need to buy extra pack. But recently now I use 2 or 3 pack for menses. If all these things are coming up, the woman should know that it's likely to be fibroid. You need to quickly have a scan done and just let them have a look at the uterus. Okay, or if a woman just notices that, okay, all those symptoms are not there, they are noticed that there's a swelling in my tummy. I say, my tummy is swollen up, it's swollen. Even when I'm not eating, my tummy is swollen up. I'm not getting fat, you know. It's not as if I'm getting fat, then everything is getting fat. No. So at times when you say, okay, madam, lie down, let me say, oh, madam, I can feel some mass here. It's likely it might be fibroid. Let's scan and look at it so that we know, are we dealing with fibroid? Are we dealing with an ovarian cyst? So that we know that, oh, okay, which one are we dealing with? So all those things could be a telltale sign to say that, okay, I'm likely to be fibroid.
Okay, I also want to digress a bit. Can you differentiate for us, can you tell us the difference between ovarian cyst and fibroid?
Oh, beautiful. Fibroid is growing from the womb.
Okay.
Ovarian cyst is just like it's called cyst. It's a cyst that is coming from the ovary. It's just like it's going like a balloon filled with water. on the ovary.
Okay.
Most times, when you see, we have a language in gynecology. We put their hand on the fibroid. There's this woolly feelings, slightly hard woolly feeling that you feel. Whereas in most cases of ovarian cysts, it's usually softer, especially if the woman is not the fat type, the abdominal pad is not so thick that you can palpate easily. So on the average, on a clinical assessment, you can differentiate a little when you examine. But when you put the woman down and you scan, the scan will tell you a clear picture.
Exactly.
Oh, this is a fibroid that I'm seeing here. This is a cyst with a fluid inside that I'm seeing here. So you can differentiate that.
Okay, thank you for that, doctor. Now, what are the available treatment options for fibroids, both surgical and non-surgical?
Good. The issue is that most fibroids are asymptomatic and they are small in size. For those ones, we don't need any treatment. Now, for those that are symptomatic, either pain or excessive bleedings, the important thing is to remove the fibroid out. Once you remove it, the womb is free. Then the question is, what means of movement, what techniques are you going to use to remove it? If the fibroid are just one or two, not so big, it can be drawn through what we call the pinhole surgery, through laparoscopy. Laparoscopy is a system where we insert small pipe in 2 or 3 places with a camera. We saw it and we just remove it through the small pipe, and the person is not opened up directly. That is available in this country. It's available in Nigeria. Most of our gynecology, or most of us does it. You know?
Is that then same as blasting?
Another means is to open up.
Is that same as blasting?
Is that?
Is this same as blasting? Blasting.
Blasting.
Yes. Some people say they blast.
No, laparoscopy.
Okay.
Yes, that's laparoscopy. Yes.
Okay.
We can also, at times, the fibroid can just be below the lining of the womb, and maybe 1 or 2. We can also increase it through hysteroscope. We insert a pipe through the vagina into the womb, and we put the camera and the scissors through it, and we just remove it. It's true also non-opening up directly. You understand? All those are available with us here in Nigeria. Now, but when we have so many, because our patients don't present early, people don't go for routine medical checkup. Some of them, I saw a woman a few years back, or 4 years now, 4 years. She has fibroid that is about 40 weeks size of a pregnancy. And I asked how long. He said it's been there for 15 years. Why don't you do something? Said she was afraid of surgery.
Yeah, many people are.
She wanted to have a child. Yes. Most people, the issue is that the fear of surgery is very common with our people. So instead of that, they will look for alternative means. Yes. And most of these alternative means don't really do anything. Most people will tell you that they have been taking different concussions, but we can't see any significant difference in this growth until we move on. So when there are many like that, we need to open the womb and remove those fibroids one by one. The highest number of fibroids that are removed from a single womb was 209.
What?
Yes, 209. And beautiful enough, we're able to save the womb back. And a month after, the woman menstruated normally, you know.
Wow, that's interesting. That's interesting and scary at the same time.
Yes, at times again, it also come so earlier than we expected. Most of the time, we expected fibroid to be multiple, so many in women in their 30s, mostly in their late 30s and thereabout. But the youngest lady I've operated for fibroid was a 21-year-old girl, where I removed 17 pieces.
Interesting.
So, you see, it depends on the body system. This thing varies, yes. So, method of surgery, either you open up or you do the pinhole if there are just few pieces. When you open up, you remove. Then there are other means where there's some medication that could shrink the fibroid, but they are not likely going to solve the problem of multiple fibroids, because when you give these drugs, within few months, the fibroids appear smaller. But you can't take the drug more than 6 months because it also has some medical effect on the woman. So you need to stop.
Right.
By the time you stop, what we have found out is that by the time you stop, few months after, the fibroid has a rebound growth. It could even, by the time you are checking the woman 9 months after, it's even bigger than when you started from the drugs.
Wow.
So, yeah, those are kind of things.
So is it advisable for somebody, for instance, who is not ready to go into childbearing, but discover that she has fibroid, to go for the surgery? Is it advisable? Won't there be a regrowth?
No, if it's symptomatic. If it's symptomatic, this woman needs to live a healthy life.
Okay.
A woman is not born because of childbearing, for God's sake.
True.
I mean, this woman has a life to live. A woman that, say for instance, the 21-year-old lady that I operated. Why did I do that for her? She's young, she's not married. But this woman, this lady, every menses, she will take 3-4 pints of blood, 3-4 pints of blood, every menses. So she bleeds like a slaughtered cow every menstruation. And for God's sake, she needs that life. She needs to be healthy. She's somebody's daughter, you know. She needs to be...
Can lifestyle changes or dietary modification help manage fibroid symptoms?
Nothing significant have been found. So there are a lot what I call it. There are a lot of theories that came up, red meat, all that. But we found out that when you see somebody with multiple uterine fibroid and all that, and you look at the background where it's coming from, I told somebody from a rural village. As he doesn't eat, he hardly eat meat self in the village there. So, and the height is about 20-something fibroid in her womb. So there are a lot of suggestions and a lot of theories, but nobody can say specifically that this is what is causing the growth of fibroid. No. But we only do one thing, is that if fibroid will be there, if it's the woman that has a womb, if fibroid will be there, the likelihood that, it's of black origin, it's an African woman. If fibroid will be there, if she has been menstruating 10-15 years and she has not been pregnant, the chance of the fibroid too is very high for her. That's it. But notwithstanding, you see some few women who, I remember I scanned a woman yesterday, she's 48, the womb is clean, there's no fibroid, she never been pregnant in her life. Okay, another one embarrassing thing, a 60-year-old woman who walked up to me that, doctor, I need a child. 60, the first thing that struck my mind is that, I wonder how many fibroids have been in this woman's womb. When she lied down, I scanned her, lo and behold, there's no single fibroid in her womb.
Wow.
And of course, she has a straight way for IVF process, and she's carrying twin pregnancy now.
Interesting.
Then she's going to deliver, by our calculation, the twins will come in 2 months after her assisted birthday. No, a month after her assisted birthday.
Are you for real? Okay. This is eye-opening, really, and I'm sure many of our viewers will see this as very eye-opening too. Okay, so I want to ask, can fibroids increase the risk of certain gynecological cancers? You know, we have a lot of gynecological cancers. Can fibroid, yes, the risk, yes, of certain gynecological cancers?
No. You see, fibroid work alone. It's not related to any colony tumor, brain tumor. No. It works alone. The only thing I said, just like I said earlier, is that study has shown that about 0.001% of fibroid may undergo malignant changes, but it's extremely rare. Do you know that up to today, I'm still waiting to see one? And I know how many fibroid has come my way in over 25, for over about 2.5 decades.
So that's good news.
Maybe most of the things, we're able to try to look at a study that maybe that initial study is not really, maybe the blacks are spared of that. We don't know yet. Because that so-called chance of malignant changes, it doesn't seem to be common with our blacks at all.
Praise God. That's encouraging.
Notwithstanding, we also have it at the back of our mind. That's why anytime we remove fibroid, we send for histology to be sure that nothing has changed There is still the same fibroid tissue, and not that maybe some part of it is already undergoing cancer changes. So every fibroid you remove, you must send for histology so that you can have a peace of mind.
Okay, great. So what are the psychological impacts of living with fibroids? Are there any support resources available for such individuals?
Oh, psychologically, most of the time, these people have very large tummy, and people start calling them Iyabeji, mother of twins, mother of twins. And they are not pregnant. Some of them are not even married. Some of them are married, they even have fertility issues, So some of them are even, the marriage has broken down because of infertility, and they keep calling them Mama Beji, all those things. So if I affect them psychologically. Then some of them have these abnormal menstrual flows and all that. It affects them psychologically. When they see the sign that menses is coming, their mood is down because they know how they are going to be bleeding and bleeding and bleeding. Some of them have excruciating pain during this menstrual period. And anytime they are looking at the calendar, the remaining 3 days, it's like, it's as if a dead warrant is on the way coming. So it's affecting them psychologically. There are some of them that are pregnant with fibroid again. They have abnormal pain along with the pregnancy. In fact, some of them they outgrow the blood supply and cause a very bad pain for the pregnant woman. So it affects them psychologically.
Okay, I know of a young girl, a young teenage girl. Okay, from teenage years, like I think she started about 13 years. She started menstruating about 13 years old. And right from the beginning of this cycle for her, it's been horror, very horrific for her. Would you say such a child has fibroid at age 13?
No. You see, let's look at it closely. Most girls, when they started their menses, the menses will be erratic. Now the age of menses has dropped now to 9 to 10 years now.
Yes.
Because of good nutrition and some other things. That's a topic for another day. Our parents menstruated in 17, 18-year-old, but our daughters are menstruating at 9, 10, 11 years. Then the present generation are even menstruating at 9, 10-year-old. Now, so when a girl child started menses, she could have all these irrational things like pain, very bad menstrual pain, irregular menstrual flow. Flow can be for 1 week, 2 weeks, 3 weeks. This can be, again, we just imagine somebody that just learning driving. You see the way they learn and the way they drive. They enter bush, enter road, enter bush, enter road. So when a young girl started menses and they come to us like this at gynecology, we tell them, my daughter, don't worry. You are just like a learner. Your hand will soon be smooth. Within the next 1 or 2 years, the menstrual cycle becomes stable, and some of these irrational complaints will become smoothing out. But notwithstanding, there are some girls that they can have very, very bad dysmenorrhea.
I'm aware about estrogen in women. Many times when women have cramps, I've heard a couple of doctors say, the level of estrogen is much. So my question to you now is, how does hormone therapy, some people say there is hormone therapy that can work for fibroid issues. Okay, so how does this hormone therapy affect fibroid? And when is it typically recommended as a treatment option?
You see, like I said earlier, most women that have this excessive bleeding because of their uterine fibroids and all that, when they take some of these hormone therapy, the symptoms will definitely go down.
Okay.
But like I said, it's not a permanent solution to uterine fibroids. Or maybe the woman just want to have some relief for some time. You give it to her, the symptoms subsided. Or you see a woman that is close to her menopause, and you just give her this hormone therapy to subside those bleeding for that period, knowing fully well that she will soon go into menopause. And at menopause, most of those symptoms of fibroid usually go down.
I see. Why is that? Why at menopause?
Because the hormones that keeps a woman normal menses, they have already, there's hormonal changes that occurs at menopause. So let me just, it's just like, since the monthly menses are stopped, so there is no nourishment to put it in that language for the fibroid again. So it's like you are starving the fibroid to death. So they can gradually start reducing, but nothing is nourishing them again. The woman during the reproductive age group, she's nourished and well blessed with hormones that nourish everything in her womb, including the fibroid that you don't want.
Now you know and have a full understanding of fibroids. The least you could do, therefore, is to tell someone who in turn will tell another about this show. So share, like, and subscribe. May I also add that whatsoever prescription you may have from your doctor, Conga Health is right here to help you with the original medication straight from the producers. So, for questions, comments, and sponsorship inquiries, do not hesitate to send me a DM on 08033 220367. Until next time, think health matters. Think Talking Health with Bumi. Bye for now.